Welcome to Dentistry and You. I'm your host, Dr. Casebolt. I want to welcome you back to Kansas City Alive. Tonight, I'm going to talk about those most often asked questions that people ask their dentist. So for you people out there that are watching, if you have a question about dentistry and would like to call, for gosh sakes, this is your chance, because I'd like to at least talk with you, give you a chance to ask your question. Maybe I can come up with some interesting ideas for you. So tonight we're going to talk about those most often questions that are asked of the dentist. So to kick the whole thing off, I thought we'd talk about gum disease. A lot of people ask me about gum disease. That's one of the most talked about things in dentistry today. Gum disease is an infection. Most dentists refer to it as periodontal disease. I've heard it referred to as pyorrhea. I've even heard terms such as trench mouth. Gosh, that's a horrible sounding term. Let's just call it gum disease. That will work. Gum disease is an infection of the gums, and its origin is very, very simple. If you don't brush your teeth, if you allow plaque to accumulate around your teeth, eventually you develop tartar or calculus, the hard debris that accumulates around the teeth. If it stays there for any length of time, that calculus or tartar, as it's more commonly referred to, pollutes, irritates, infects the teeth. It infects them to the point that the gums become so ulcerated and so irritated that they actually shrink away from the teeth. Now, this can be a very serious problem because the majority of American people who lose their teeth due to periodontal disease or gum disease. So I guess the most important thing to keep in mind in terms of that question that you would ask, what is gum disease? It's strictly an infection of the gums. The infection comes from bacteria that are in plaque. The bacteria produce plaque. If you eat something that's sugary or starchy, my favorite thing is a Snickers bar. It's just loaded with sugar. Potato chips. Potato chips have carbohydrate. They're very starchy foods. Even things like rice, baked potatoes, the normal foods that we would eat for our carbohydrate, these kinds of foods also can contribute to bacterial propagation. The bacteria can eat these kinds of foods, they consume them, they produce plaque, and they do the one thing that is so very, very bad that causes dental disease. They exude an acid. This acid is the polluting factor that causes gum disease. It also causes tooth decay, and we'll talk about that in a little bit. But remember, when you ask your dentist about gum disease, remember, and most importantly, remember that the ball is in your court. It is what you do every day of your life that will affect what will happen with your gums, the supporting tissues, everything that supports your teeth. Now, what good will your teeth be if they're in perfect condition, but they're in the palm of your hand? They won't do any good at all. You need the gums, you need the bone, you need that support for your teeth. Now, I have a small illustration that I can actually show you the various stages of periodontal disease. And I'll go ahead and hold this up. Over here to the left of your screen is a pair of teeth, a molar and a premolar. The molar tooth and the premolar tooth both show relatively normal bone support. You can see where the arteries and veins come into the root of the tooth. You can see the little ligament that actually helps support the tooth. It actually has little fibers that run from the bone into the root of the tooth. As plaque forms around the teeth and is left there for several days, eventually the calcium phosphate that's in your saliva begins to plate out and solidify that plaque until it becomes tartar. Now we'll go over here to the right side of your screen and you can actually see an advanced case of periodontal disease. Here we have tartar all over the root surface now of the tooth. Have you noticed how the bone is actually receded down the tooth? This is one of the things that happens when you have prolonged infection. In other words, that tartar has been there so long and has polluted so severely with its acids that has actually caused, instead of an acute infection, a chronic infection, and the bone did the only thing it could do, wall itself away from the infection. And as you can see, that the gums have already come down, almost exposing half of the root surface of the tooth. And this is a very serious problem because this is how the majority of people lose their teeth. I understand we have a phone caller. Please go ahead. You're on the air.
Hello?
Yes.
I think maybe that's part of my problem. I'm 57 and I have had quite a bit of illness this last year.
Yes.
And I haven't been able to come to a dentist. And I had, my gums are pulled back from my teeth. A dentist had told me once that my teeth were too small for my mouth.
Uh-huh.
So I have a wide space in front.
Uh-huh.
And when I lost some when I was pregnant with my children, they had moved back even further.
I see.
And I'm having some problems like in the jaw area.
Have you had a lot of bleeding around your gums? Are they swollen?
No, I haven't. And as far as swelling, I don't believe so.
Okay. When you floss your teeth, do you notice a lot of bleeding on the floss?
No.
Okay. One of the things that I recommend about gum disease, and one of the best ways to detect it yourself, is when you brush and floss your teeth, if you notice any bleeding around the gums, especially when you spit the toothpaste out, if you should notice bleeding or discolorization of the toothpaste, this is an indication that the gums are swollen, irritated, and there's a lot of bleeding present. This is how we determine whether there is active gum disease or periodontal disease in the mouth. Now, one of the best ways to deal with this, and the thing that I recommend that everybody do if they suspect that they have a developing gum disease, is that they call their local dentist. If they don't have a dentist, ask a friend. Ask who they go to and who they like to see for their dental care. Go in, spend a couple of moments at the dental office. Let that dentist examine your gums and your teeth. If you have advancing gum disease, it could be treatable. But if you let it go too long, as I had indicated before on the little poster that I was displaying, eventually the bone deteriorates to the point it's very difficult for the teeth to stay in place. And of course, the last question that I ask, are any of your teeth loose? Do they feel like they move around?
No, they don't really. I think I'm about to lose some filling, so that's where I think the problem might be.
Well, it could be, and again, the advice is still the same thing. You need to have a periodic visit to the dentist, and I realize that not everybody can go in every 6 months. I haven't seen the dentist in a year and a half, and I'm a little embarrassed to say that. I shouldn't say that, but it's really true. And one of the reasons I do self-examine my own teeth. However, there is no excuse for going in and getting a good, thorough dental examination, and that's what I'd recommend that you do. So if there is a problem, find out about it early enough so that good, positive things can be done about it to help you out.
Well, I was in the process of, I sent for my insurance forms. I'm making an appointment. I don't know with who yet because I was going to talk to my daughter-in-laws. They both have different dentists, I believe. I can't take, nitrous oxide?
Well, a lot of people have difficulties with that. I don't advocate it either.
MOA inhibitors,
yes.
And I can only take the needle.
Yes, I understand. We're going to talk about that a little bit later, too.
Okay. Well, I'll watch it then.
I tell you what I really recommend. I really want you to go make a dental appointment. Get your insurance in order if you need it. Just be sure that you make that dental appointment. For gosh sakes, get in there and get those teeth looked after and follow the dentist's instructions or the hygienist's instructions very closely because they can help you save your teeth, and that's most important.
Yeah, I had been doing it. I had a partial, and it was bothering me, and I took it out.
Uh-huh.
And I'm going to have the dentist refit it, I think. And so I thank you very much.
You're quite welcome, and thanks for calling me.
Bye.
And we have another call. By gollies, we're busy tonight. Please go ahead. You're on the air.
Yes, can I ask a question about teeth realignment?
Sure.
Why does it take so long for a person to get their braces taken off?
That's a very good question. In fact, that was one of the things I was going to talk about, but I'm glad you brought it up. With orthodontia, or orthodontics as it's called, the placement of braces on the teeth, the idea is to move not only the visible parts of the teeth into the correct position, but also the roots of the teeth, which are also part of the teeth, obviously have to be moved as well. Now, it's very, very important to an orthodontist that when the case is finished, that not only are the biting surfaces of the teeth in the right position, but those roots have to be aligned just so that the patient's occlusion, the way their teeth come together, and the long-term results are stable. Now, if you move teeth too quickly through the bone, you run into some very serious problems. And I'll go ahead and refer back to my little diagram if we could. As I pointed out before, there are arteries and veins that come into the very roots of the teeth, as you can actually see here on the diagram. These arteries and veins are responsible for supplying nutrients to the tooth. It's very important for those to be there. And if you pull the tooth too quickly, or if you apply too much force to a tooth to move it, you might actually sever those arteries and veins. And that's another bad sequel to moving teeth too quickly. In other words, moving teeth, or orthodontically moving teeth, is a little bit like orthopedics in a sense. You are moving something through bone. And as the root moves through the bone has to be removed by specialized cells in the area that the root is moving to. And in the area where the root is moving away from, specialized cells have to replace the bone. So in other words, the bone is constantly being resorbed and replaced. And this takes time. In other words, you can't rush a good thing. And that's the important thing I'd like to mention about that. So orthodontia, and of course it depends on the case, takes time, and you should never rush it.
Can it take up to like maybe 3 years sometimes?
Yes. I had braces when I was quite a bit younger, and it took 4 years, plus a retainer that I had to wear for an additional 3 years. So it took a very long time. And I was very fortunate to have that service provided for me. I was very fortunate indeed. Do you have any other questions?
Yeah, what would happen if you took them off too soon?
Well, that's not a good idea either, because assuming, of course, that the case is not completed. Let's suppose they're taken off before the teeth reach their ideal position. There's a very good chance that the roots themselves are not exactly where the orthodontist intended them to be. When the braces are taken off prematurely, there's a tendency for relapse or instability in the mouth, and that's not good, because it undoes all the good things that the orthodontist tried to do in the first place.
Oh, okay.
So like with any treatment, you should always follow through completely and make sure that it's completed properly.
Oh, okay. Okay, thank you.
You're quite welcome, and thanks for calling us.
Bye-bye.
Well, there are a lot of other questions that patients ask me. A lot of these questions, in fact, they're probably too numerous for me to even go into tonight, but by gollies, we'll take a stab at it. I approached a lot of my colleagues, patients that I've known for years, and again, there were a lot of very straightforward questions that people ask. One of the other questions, do my teeth or a particular tooth, does it have to be pulled, or can I save it? That's a very continual, ongoing question that I hear. I hear that question every day, because many times I have to pull teeth. I have only one thing to say about that. Pulling teeth is the last resort. I have seen many teeth that were given up for hopeless, yet we worked with them, we cleaned them, the patients worked with them every night and did everything that they were instructed to do, and many of them still have their teeth, even though there wasn't much of a chance of saving them. So I guess what I'm saying, and what I'm trying to impress upon you, every tooth is like an individual. It has an individual job that it does, whether it's to bite into an apple or whether it's to chew up the food. It's very important. And not only that, they look good. There's nothing like a good smile. Losing teeth is, again, the last resort. Ask anyone who has dentures. Nothing against dentures, but they are no replacement for your original teeth. If you think your tooth can be saved and you've been told that it might have to be pulled, and if you have any doubt about that, get a second opinion. People ask me all the time about that. Would you be offended if I get a second opinion? And I say, no, not at all. Please do so. I always feel good when people get a second opinion, because they come back and they say, you know, doctor, you were right. And I always feel really good about that. So don't hesitate to get a second opinion. Try, for gosh sakes, to save your teeth. Every one of them is very important. Not just the front ones that you smile with, but every one of them. Now, other questions that people ask me are, can I make my teeth look white? Well, what is white? Everybody has different colored teeth. It's intrinsic to the person. Some people have darker shaded teeth. Some people have perfectly pearly white teeth. Some people's teeth have become stained with coffee or cigarette smoking. There are a number of products out there, and by the way, if you think that your teeth are stained by cigarette and coffee, cigarette smoke and coffee, or tea, that's another item that really stains teeth. They have a lot of commercial products out there. All you have to do is watch cable TV at night, and by gollies, one of them will come on, and they'll for $19.95 you can buy a kit that you can use, and by gollies, it will in fact make your teeth look brighter. And actually, I like some of these kits because they're safe. A lot of the things that we do to brighten teeth involve caustic chemicals, and I'm not sure I really like that. So some of these over-the-counter kits, I've heard that they're really good. A lot of patients tell me they work. So I'd say if you feel comfortable with it, go out and spend $19.95. I don't think it's going to hurt you, and I think it will help. And if it works, you can tell a friend. And that's always good advice. Other questions that I get, should my child have regular fluoride treatments? I love this question. You know, in dental offices, used to be a time that when your child went in, they'd cram that tray full of all that nasty tasting gel in there, and they'd swallow half of it, and then they'd vomit on the way home because it was so putrid tasting. Well, what the heck. It is a known fact that fluoride, when it's applied to the teeth, does in fact slow down the process of tooth decay. And that's good. But by gollies, I'll tell you, fluoride treatments in a dental office or continual fluoride treatments are just like medicine. You should only take them when they're really necessary. When a patient has a lot of severe tooth decay problems, then they need to have the fluoride. But if a child doesn't have any tooth decay, and if they're brushing with a good fluoride toothpaste, well, they really don't need all that fluoride. And they might be getting too much because a lot of times young children, especially under 2 or 3 years of age, might be swallowing some of it. And they might be overdosing on fluoride. Too much of anything is not a good thing. So I would say, in regards to fluoride treatments, they are optional at your dentist's advice, especially if your child has tooth decay. Another question that I get a lot, is it going to hurt? Well, anybody who's had surgery will tell you that they're sore afterwards. If you go into a dental office in severe pain, you may leave with some pain, but it will be better, and it will get better. Most dental pain is a result of infection. An infection takes a long time to develop. That is why I recommend that you go in every 6 months and have your teeth examined. Have x-rays taken once a year. It's very, very important because you must maintain the health of your teeth, prevent infections from occurring, and in that way you can keep your teeth beautiful, you can save your teeth, prevent them from having to be extracted, and you will go through life with a healthy and wonderful smile. And again, I want to thank you all for watching Kansas City Alive and my segment, Dentistry and You. I'm your host, Dr. Casebolt.
It's time for You Lost Your Life with your hosts, Christ Dummies, Vince and Larry.
Hi!
Hello, and welcome to the show that proves if you don't buckle your safety belt, the loser is you.
That's right, Vince, and by not buckling up, you could end up in places you never dreamed.
Like traction!
Or the emergency room!
Plus, Larry, if you're not buckled up, you could maybe take a ride in a beauty like this. Stay tuned!
You're going to learn a lot from a dummy. Buckle your safety belt.
Hello, welcome to Dentistry and You. I'm your host, Dr. Casebolt. Tonight I want to talk about a very, very important aspect of dental care, the psychology of dentistry. Every one of us, when we approach dentistry from the standpoint of a patient, or maybe the standpoint of being the doctor providing the dental care, we are approaching the psychology of the patient. We have to deal with patients because patients are what the whole procedure of dentistry is about. With me tonight is Dr. Alan Glaros from the University of Missouri Kansas City School of Dentistry.
Right.
Alan, I appreciate you coming down to Dentistry and You, my segment, and the show Kansas City Alive, and I really do appreciate it. I know it was a last-minute thing, and we rushed down here, and the roads were terrible. Everything happened at once, but we got down here, and again, I really appreciate very much you coming down.
I'm delighted to be here tonight.
Super. There's so many things that involve the psychology of dentistry. We are dealing with people, we're dealing with patients, we're dealing with what their thoughts are and what they're thinking about when they go to the dentist, sometimes for the very first time. When a 51-year-old individual comes to me for the very first time for their dentistry, it's like a child. What I want to talk about is what should we do as dentists, and what should patients do as patients when they're coming to that dental appointment for the very first time in pain.
Okay. Well, usually if someone's coming to you for the first time and in pain, that probably means that they've really neglected their dental care for a long, long time. And unfortunately, what that means is they're probably going to need a whole bunch of fairly uncomfortable and lengthy procedures. The reason they probably didn't come in the first place is that they were probably pretty frightened and scared of dentists to begin with. And I suspect that comes from a pretty old belief that when you go to a dentist, what you're going to get is someone poking around your mouth, and it's really going to hurt, and you're going to be incredibly uncomfortable, and it's just going to be an overall horrible experience. Dentistry, as it's practiced today, is not at all like that kind of stereotype. Dentists really know how to use medications. They've been trained in interpersonal skills for dealing with patients who are feeling uncomfortable or feeling scared and anxious. And they know how to put people at ease and know how to make the procedures pleasant.
Right. That's important because I recall as a child, and I was very fortunate because my parents could afford good dentistry, and I can't really say that I ever had a negative experience in a dental chair, although I got my share of dental fillings. I have a filling in every tooth. I hate to admit that, but it's really true. And I'm sure that there was probably some concern and upset on my part at the time I was having the procedure done. As a dentist, I know what's involved with removing an old filling or cutting tooth structure to put a filling in, and it doesn't bother me very much. But it is important to realize that a lot of patients are extremely apprehensive about this. When they go in for dental treatment, positive attitude is really important. They know, or should know, that the dentist is not going to hurt them, that they're going to use every possible thing at their disposal to make their dental procedure and their appointment comfortable. I guess the next question I might ask is, what would you suggest to our patients out there, our people out in TV land that are watching this? What can we suggest to them to either suggest to themselves or to their children or to the loved ones that are going to receive dental care? What can they do to prepare themselves and make that dental visit very comfortable?
Sure. Well, for the folks who have never been into a dentist for the first time, it's likely that they learned that kind of fear from someone in their family. It might have been a parent, a relative, a brother, or a sister. And you really can't undo your past, so what you really have to do is to find a dentist who is comfortable dealing with someone who's got a lot of fears. And very often these kinds of dentists will take the time, show you around the office, introduce you to the staff, show you the place where they do procedures, really try and get you to feel very accustomed to the location. And then they'll gradually sort of bring you into the procedures. They'll do little things, make it real easy. The idea is not to make it like a sink or swim operation for them, but rather to make the patient feel just as comfortable as they possibly can. Now, for an adult who's got that kind of fear, finding that kind of dentist will be a real help. But what we can do as parents is to send our kids to a dentist on a regular basis, and again, I think what you're going to find is that the kind of care that's being provided these days is really quite good. And so the kids will come away thinking it's no big deal. It's kind of like going to see the pediatrician. And Yeah, occasionally it might be a little uncomfortable. I mean, pediatricians give you shots, and that's sometimes not so great, but overall it's no big deal. And the kids will just get real used to it. I have a 7-year-old son, and we've been taking him on a regular basis, and he just has no problems at all about going to the dentist. Unfortunately, his teeth are a lot bigger than his mouth is. So
that happens to a lot of kids.
Oh yeah, but he's going to need orthodontics eventually, yes. And to prepare him for that, we needed to pull a couple of his teeth. And he doesn't like when that happens, but he doesn't feel afraid of it. He knows that the dentist will take very good care of him, that he'll be treated well, and it's like, if I have to do it, I will. He'd prefer not to have that done,
right.
Of course, and I don't blame him. But still, it's no problem for him. So I think that a parent who can send their kid off and just do it on a regular basis, and if the parent's feeling kind of anxious about it, well, the best thing they can do is sort of shut up and just let the kid have as good an experience as possible.
Sometimes I think they have better attitudes than the parents.
Well, I think you're right there. But once the kid has a series of good experiences, then it'll be easy from that point on.
I think that's wonderful, and I've always advocated in my show over the last year how important attitudes are. Attitudes are so very, very important because parents foster attitudes in children. Mm-hmm. They do. Children learn from their parents. They learn from their peers. They learn from all of the other adults that are in their life. Mm-hmm. And that's so very, very important. And I think for dental care, and as a dentist, I'm going to concentrate on that. Sure. Physicians have the things that they concentrate, but as a dentist, I would concentrate on dental care. Mm-hmm. And it's so very, very important to foster a good attitude with our children. Right. I would also invite the people out there who are watching our show, Dr. Glaros and myself, Dr. Casebolt, would very, very, very much entertain your questions. You can call us. There is a phone call number. You can call us at the number that appears at the bottom of your screen. We would love to hear from you. We can talk to you here live on Kansas City Alive. And again, I can't say how very important your phone calls will be to us. Over the years, I deal with patients young and old. Mm-hmm. A lot of times, I'll get an older patient that has not come in for dental care, and they might be 50 years old, 60 years old. Many, many years have passed, and they've not received any kind of dental care whatsoever. And they might have problems. Again, they might not, but they have apprehensions about dentistry. I think what is important, I guess what I'd like you to comment on, is not just so much our young children out there, our young adults, maybe so much, but some of the older or more mature individuals that have apprehensions about dentistry. What can we tell them? What should they feel? What should they expect when they go to the dental office? Let's say after 10 years of neglect.
Gosh, after 10 years
of
$10
million question,
right.
Sorry.
Well, 10 years is a long time not to go without any kind of dental care. And
they are concerned because they have all sorts of ideas about what might be wrong with their teeth, right or wrong.
Mm-hmm. Mm-hmm. Again, my guess is, except for the people who really can't afford care, and that's a real problem for a lot of folks, but taking that group aside, if you haven't been for a long time, I suspect that you've been kind of scared about going, or maybe you're new to an area and you just really haven't had the chance to get around to find someone. If you're having a lot of pain, it may be something that's a pain that's going to just go away once this immediate problem's taken care of, or for some people they're going to experience chronic pain. Maybe they have some arthritis in the temporomandibular joint. Maybe they're having chronic headaches. And dentists are more and more able to take care of those kinds of patients as well. I guess my advice to those kinds of folks would be just call, make the appointment, show up. I think you're going to be pleasantly surprised.
I think that's excellent. I have seen so many patients that haven't been in for 10, 15 years, and I find that the majority of them have a very positive experience after they've been in. With any new patient that's seen, I try to keep their dental procedures down to a minimum at the first appointment and try to do as much diagnosis as possible. I wanted to touch on another factor. As a dentist, I see this a lot. I don't know exactly how to approach this, but I'll go ahead and be blunt about it.
Okay.
What the heck? We're on live television. A lot of dentists that I've talked to experience stress in their dental lives when they go to their offices at 8 o'clock in the morning and see their first patients, or 9 o'clock, whatever their scheduling is. They see their first couple of patients, and they always inevitably are exposed to stress. The stress that they're exposed to is a stress from a patient that is themselves stressed out. What can you tell our people at home what they can do to minimize stress that they might exhibit to the dentist in order for the dentist to have a better rapport with themselves and with their patient?
Sure. I guess I would suggest to a patient not to hide it. I make it out in the open, let the dentist know where you're at. Tell them that you're feeling uncomfortable, because they know what to do, and they have techniques for dealing with it. I think it really gets to be a problem when someone has some sort of concern and they're afraid to mention it. They're saying, oh, I had this little white spot up here, and I don't really want to bother you with it, and so they wait. And maybe that's a serious problem that needs to be addressed. Maybe they have a couple of questions that they feel are kind of stupid, and they might be embarrassed to ask. I'd say ask them anyway, because you'll get the answer that you're looking for, and if that puts your mind at ease, well, that's a good thing to have.
I think that's great. Again, I think the most important thing is that everybody who comes into the dental office or the dental circumstance or situation to receive treatment should get the very, very most that they can possibly get from their dental treatment, because they're paying good money, whether they're paying it through their insurance company. I don't think that's so much an issue. What is important as dental practitioners, we have to provide the very best that we can for the patient in their particular situation, whether they're fearful or not. And Alan, we have a telephone call. Please, go ahead. You're on the air.
Yes. How come some people are afraid to come to the dentist, even at younger ages and older ages? Do you know why that occurs?
Well, I guess my answer there is that they've learned from someone that going to a dentist is a scary thing to do. Kids, for example, learn it from their parents. They don't really learn it from that many bad experiences because they haven't had them. I suspect there are some older patients, on the other hand, who have had bad experiences with their personal dentists, and that's kind of unfortunate, but I think you need to give the dentistry of today a try, because I think you'll find it much more pleasant and much more enjoyable.
I think that's so very important. And I would say this to children. I can remember 9 years ago, when I was in dental school, and I had a young child who, there were two of them, and they came in, their parent brought them in. And being a neophyte, gosh, I hate that term, but I'll use it. It's been used before. At that time, the two children, the little boy just marched right into the chair, and he was just happy as can be. We did the whole thing, and it was over. The little girl very reluctantly got into the chair, and she looked at me and let out a scream and ran. By the time we chased her down in the school, and there were all the hallways and everything, I finally got her to calm down, and I asked the question, "What's the matter?" And the mother didn't know anything. She didn't know what the problem was. And by the time we figured out what was going on, the little boy had told the sister that she was going to have all her teeth ripped out. And I mean, she was absolutely frightened. I mean, she thought, here she was in a completely unfamiliar surroundings. Everything was up there. I mean, a little child, 5 years old, 4 years old, I can't remember exactly, but I mean, everything was big, and it was up there. Equipment, everything was up there, and it was a frightening situation for her. In the 30 seconds that we've got left, what would you tell our young parents out there with young children, what they can do to prepare their children psychologically for their first dental visit?
Probably the easiest thing that they can do is to give them honest answers about what they can expect. Tell them that describe what a dentist visit is like, what they're likely to see, the sounds they're going to hear, maybe some of the smells. Tell them that there's nothing to be terribly frightened of, and that the dentist who's going to treat them is going to be kind and gentle.
Alan, I think that's wonderful. And again, I so much appreciate you coming down to Kansas City Alive in my segment, Dentistry and You. And again, I appreciate you very much for watching my segment, Dentistry and You. And I want to tell you to watch Kansas City Alive every night at 6 p.m. here on KCCP Channel 30. Again, thank you and good evening.
When you're growing up, it's tough enough when emotions are stirred. And honesty, it's so hard to see when your vision is blurred.
Whether you're a boy or a girl, Boys Town has a caring person just a phone call away who will really listen to your problems and help you solve them. Call the Boys Town hotline toll free, 1-800-448-3000.
Here's tonight's primetime lineup on KCCP TV.
As we leave, here's another look at the weather or not forecast. Be sure and tune into Wednesday's edition of Kansas City Alive, because Ruth Roden will be here with guitarist Danny Embry on the music scene. Rochelle Kling will begin a two-part series on Just for Kicks. She'll visit with Dr. Daniel Hussar, and they'll talk about medication management today. And Kansas City astrologer Tom Davidson will be here with Star Talk Astrology. He'll take your calls and answer your astrological questions. Be sure to tune in to Kansas City Alive Wednesday night at 6 p.m. Thanks for watching. Until then, have a great evening. Good night.